And welcome back. Well, Black women are 3 times more likely to die in childbirth than non-Hispanic white women. This statistic has been known for a while, but now a centuries-old tradition is becoming a potential solution. Amber Strong explains.
Samantha Griffin says her job is to be the best friend an expectant parent never knew they needed.
When they have questions, we can answer them. And when they need something during birth, whether it's ice chips or some sort of massage, we can help with that.
Griffin is a doula and owner of DC Metro Maternity. Doulas are women who typically don't have formal medical training, but are employed to provide guidance during and after a pregnancy. Many of Griffin's clients are fellow Black women seeking support, especially during delivery.
When Black women are in those rooms, a lot of times, if everyone around them doesn't know them well or doesn't look like them, it can be a little intimidating because birth is more vulnerable than, say, going to your job every day.
Non-Hispanic Black women are almost 3 times more likely to die during or after childbirth, regardless of education or income levels. According to a report from the Government Accountability Office, the numbers have only worsened since the pandemic, with about 68 deaths per 100,000 live births.
Honestly, Amber, that's the terrifying thing. It's like you can do everything quote unquote right and still be at risk.
A lot of people like to call us advocates, and sure we are. We like to say that we help you advocate for yourself.
Jacqueline Knighton co-founded her company, Doulas of PG County, after her own negative birthing experience.
It ended up being an unnecessary cesarean section, and I ended up being very disappointed with my birth. I didn't feel like I had a lot of autonomy. I didn't feel like I had a lot of say-so in that.
Now she works to make sure women are comfortable and aware of their options in the moment.
A lot of people get what we call white coat syndrome, where they're like, okay, sure, whatever you're saying must be best, let's do that, which isn't always true. There's always usually some time to talk about it, so your doula can say, do you need a minute to talk about this?
That second voice is crucial in speaking up after childbirth too. Tennis superstar Serena Williams says her cries for help after delivery were initially downplayed.
I told the nurse I can't breathe, I need a mask. So I put the oxygen mask on, and I started coughing because I couldn't breathe.
More and more women are employing the help of doulas and midwives. Midwives often take part in the actual medical side of a delivery. Historians say the need for such partnerships isn't new.
So we can possibly trace this to the beginning of humankind with the presence of women giving birth. There were women supporting women.
Linda Holmes, author of Safe in a Midwife's Hands, says for African Americans, midwives were a necessity during slavery and later during segregation, relying on traditions and experience.
The doctors were like, they're not going to pay us much for this. We are not interested in caring for Black people and solving, for the most part, for solving this public health gap in care.
Over time, that acceptance soured when the medical community blamed Black midwives for infant mortality rates.
Once Black women were moved into hospital settings and medical care, that the infant mortality and the lack of equity and the problems that it was being marketed, if we just got rid of the midwives, everything would be solved, is not true. That was a lie.
Now both professions are seeing a resurgence as more studies indicate positive birth outcomes when that partnership is present. According to a study published in the Lancet Medical Journal, women who received doula care had about 52% lower odds of cesarean section and 57% lower odds of postpartum depression and anxiety. Doulas providing care alongside a midwife most consistently showed a reduction in the odds of a C-section.
Several states have begun to reimburse doula services through Medicaid. That means more doulas in hospital rooms. The doulas we spoke to say the goal is to create a great environment for parents, and that means getting along with the hospital staff.
I see it as a moment to collaborate with nurses, doctors, midwives, whoever's in the room.
When we walk into hospital rooms, nurses are excited to see us because that means they get to chart, they get to maybe take a lunch break and eat a little bit, and they know that their clients are still in great hands.
Both say the goal is to turn the birthing experience into just that, an experience to be cherished. Amber Strong, Scripps News, Washington.